opportunity to speak over here in front of you all. So, before starting the session, let me introduce myself. I am Dr. Vijay, a third year MBBS student from MIT Latur. So, when Prabhuji told me that today we are going to have a session for all the students who are doing their Ayurveda, so I came here with two senses in my mind. The first was of gratitude and the second one was for responsibility. The gratitude towards each one of you for blessing your precious time and making this event successful with your esteemed presence. And I was having a responsibility as a future healthcare worker that I take it as my duty to make each and every one of you aware of the benefits that I have personally got from PD Club. So now you all must be wondering, what is PD Club? So PD Club is Personality Development Club, an initiative which was started in our college under his guidance, and we are planning the same over here. So actually, what is PD Club? So it is more than an organization, an initiative which was started by students, for students, and it is nurtured under the insightful guidance of our professors, of our seniors, and gurus like Srinivas Prabhuji. So it is our collective aspiration to grow, learn, and elevate one another, not only academically, but also ethically and morally, with the knowledge, creativity, and collaboration. So our PD Club has been constantly engaged in many student-centric and community-oriented activities, which we usually carry out in our college and in other fests. So the activities include study marathons, academic excursions, we have research activities, hospital visits, medical camps, and festival celebrations. Moreover, poster presentation competitions like debates, and many such initiatives like japa, meditation. Basically everything that is required for your body, mind, and soul. I am very specific about these three because I know I am talking in front of Ayurvedic students, and in Ayurveda it is a uniqueness that in an Ayurvedic doctor not only treats the body but also your mind and soul. So it is said that if a doctor is not treating the mind and soul, and if he is only concerned about the body, then he is treating only the disease and not the actual person. So it is very important in your field. So now I will talk about my personal experience about PD Club. I have been a member since 3 years and I have personally benefited a lot. But what I believe is, more than me, you all can benefit more out of it. You may ask why. So the science that I deal is actually the medical science. I am an MBBS student. So what we deal is with the newer techniques, newer methods, modern medicine and modern techniques which are being explored. But your Ayurvedic science and our PD Club's spiritual science, both of these are very connected because our spiritual science deals with the Vedas, it has the knowledge from the same, and your Ayurvedic science is a part of Vedas, so it is an Upaved from Atharva Ved, you might be knowing. So these, since my technique is a bit distorted, but then also I have benefited. So since your technique is so aligned, it will benefit you a lot. So that is the reason why I am here today. So many of my friends are pursuing their degrees in various fields, and many of them are pursuing Ayurveda too from the colleges all over Maharashtra. So when I talk with them, I have came up with certain common things and problems that are being seen in the students. The first and the most major problem is about they are a bit little upset that they have got BAMS when they want to pursue MBBS. So the confidence level is a bit little low, and they decide before only that they will pursue their MD/MS or so on. But and I asked them what the problem is actually, why is this so? So they told me that they are a bit little in doubt that whether they will earn well. And the second one is that Ayurveda, it is comparatively slower effect, though it is 100%, but it is slow. So is it effective enough, or does people have that patience? So let me tell you about earning. If you have knowledge, if you have explored enough, and if you know the techniques right, I will tell you that many Ayurvedic doctors can come across the earnings which are very higher than certain MBBS doctors. The reason is, the main problem is we don't have an ideal role model. So one of my colleagues, his mother is a practicing BAMS and she is an Ayurvedic doctor. So what I have learned from her is, she earns from her OPD, IPDs. Otherwise, the medicines that she gives to her patients is prepared by herself. Along with this, also she gathers, she has a regular clients for certain things like, you might be knowing about Panchakarma. So all of these things are in her regular routine. So these clients are not actually deceased, but they are still her clients and they come to her. And everything, she doesn't have time for herself. She has such a great earning and she earns more than many MBBS doctors. So that's the reality. If you have talent, and she has mastered many oil therapy, massage therapy and many more therapies which are being there in Ayurveda. And about patient level, I will tell you that most of the people nowadays are literate and educated. They are very well aware about what they are taking and what treatment they are being given. So, though allopathy is faster, you know that it has many adverse effects. So, educated people usually refrain themselves from taking such medicines and they trust in Ayurveda because Ayurveda is the only science which is 100% effective and with the least side effects. So, it is a very great chance for you to build your own faculty in the literate and among the literate and educated peoples. The next most common problem which I used to talk about was the language barrier. So many of the times we need to recite slokas and everything. So let me tell you that here in PD Club we have our sessions during which the slokas are being recited. So language barrier will not be a problem anymore. The third major problem was about clinical exposure. That though we learn, we see, but most of the time we do not get enough clinical exposure. And it is quite difficult in Ayurveda. So, in our college, like we have a batch of 150 students. When we learn about anything, the practicals usually used to happen in hospitals. So the doctor used to come, he used to demonstrate, and he used to leave. But we see, we learn, but we cannot perform it because we were not exposed to that path. So at such times, what we used to do is, under the banner of PD Club, we used to contact Prabhuji. We used to tell him that this topic has been covered and we haven't got enough exposure. So all the hospitals in Latur, nearly all, and also outside Latur, all over the hospitals has been, the doctors has been well-wishers of ISKCON and they have been constantly in PD Club. So they all support him. We used to arrange our visits over there and they personally used to teach us what actually those demonstrations look like, and they used to give us the exposure, they used to let us handle the patients. So in this way we have learned, and what we are trying to do is we are trying to implement it here, that it is not technically possible for any college to arrange exposure for each and every student, but this can be achieved if technically we have taken the support from other hospitals, especially the Ayurveda. So if you want, like you have many practicals like Nadi Parikshan, I think Vaman, Basti, all of these are very advanced techniques actually, but still with the help of, Prabhuji was telling me that we have Kerala association with our 3D club. So even we can arrange the visits over there, and these people are extremely intelligent, they are the masters of these fields. So we can also demonstrate it for you people and can make you aware of all these things so that you can achieve your excellency in those fields. The next thing that I want to talk to you about, discover yourself sessions. These are our lecture sessions which are arranged by PD Club. So what are these sessions actually? They talk about the common things like who actually we are, what is the purpose of life. Then many more things ahead. It includes you might have in the Sattva Guna, Raja Guna, Tama Guna. All of these. These are the common points which are. So as I said, the science is same. So many of your points has been. So what you are learning, he is the master. So those things are already included in your lecture sections. You might be having Annamay Kosh, Pranamay Kosh. So all of these things are being covered in our DYS sessions. So definitely it would be like a revision to you so that your understanding of the subject could be better. The next thing that I want to talk to you about, we have an association with Bhaktivedanta Hospital in Thane. So actually it's a multi-specialty hospital which is based on the spiritual management. So how it works is, let me take the best and ideal hospital that I have ever seen, because it not only takes care, as I said, not only of the body but also mind and soul. They have the spiritual readings over there, they have the spiritual sessions over there, and by that I mean spiritual, not religious. So it is not something that is trusted blindly, no. It has science behind it, and that science has been told to us. It has separate Ayurvedic department as well. So when we went there, we learned about the hospital management. So they were telling us that 40% of the electricity that is required to run the entire hospital was being produced by the hospital itself. The tanks were not on the top of the hospital, but they were located at the bottom. So it was saving about 20 to 50% of its energy in transporting the water. The third thing that I learned there was, there was not a single air condition in the entire hospital, and it was entire sitting was centrally air conditioned, and that too by using ancient techniques. So it was really, if any one of you wish to have your own hospital setting in the future, it was very beneficial thing, and it was actually under the certified course called Spiritual Care and Hospital Management. So what we seen there was something miraculous, and I would like to tell the most important thing there was, in Ayurveda you know the importance of ahar and nidra, all of these things in practice. So I need not to tell you separately. But in the hospital, the food that was brought by the relatives or the patients was not allowed over there. They used to provide their own food, believing that the food has the energy that can drive one to the positivity or negativity. So that was the best thing that I have learned over there, and how spirituality can actually help. So whatever the things that Ayurveda has taught us, how they can be applied practically, I learned over there. And in the last time we visited Govardhan Eco Village. What a wonderful place it is, and it is made by His Divine Grace Radhanath Swami Maharaj. And extremely, I consider myself extremely fortunate that I was a part of that journey. So in GED, we have various sessions, all the sessions which are related to your Ayurvedic faculty. So what there was, first we learned about yoga and meditation, the proper way to meditate, how we can meditate, and what are the benefits. So I have personally very much benefited out of it. So usually we see that during exam hours, people get frustrated, anxiety spikes up. And people may deny, that students also deny during the exams that no, I don't have any anxiety or I don't have any depression. But I have literally seen students who don't stop talking during the period of exam. They usually think about whatever about the exam. So you may have faced or not, I don't know. But these are the very common things. So these japa, meditations or chanting usually helps in this. So then we have learned about, actually it was not for open for all, because it is only for the foreigners. These services are being provided over there. But as we were under the banner of PD Club and with the guidance of Prabhuji, we were fortunate enough that we got an opportunity to explore. So about yoga meditation I have told. Then the next therapy was sound therapy. So actually, we know if you have a simple headache, we go for allopathy and take some tablets that kills kidneys, isn't it? But the sound therapy tells us that they told that actually these sounds, simple sounds can cure your headache in 15 minutes without any medicine. So these techniques are really very helpful, and if you master this, I promise you that no one can earn more than you. So that's very beneficial things. That is why I'm saying that what you need to do is you have to explore and learn more things. So in that case, we have ourselves, they demonstrated us about sound therapy, oil therapy was given, massage therapy, again I told you about Basti, Vaman, all of these things were being present there. The patients were taking them, and we were enough fortunate to have it in front of us. And the most important part was the herbal lab that we saw there, a library of herbs. So what actually this is, we have seen hundreds and thousands of medicines that were being placed over there in bottles, and all of them were labeled with their local name, biological name, their use and contraindications. So as I told, we as MBBS have restraint that we can't produce our own medicine in allopathy. But you as a Ayurvedic practitioner has that one benefit that you can have your own medicines. As I told my colleague's mother, do it. So that is one of the best things, and there we have learned actually how they made, what are the processes and how can we actually make the medicines that we require in our daily practice. And at last we visited the botanical garden of GEV. All the rarest medicinal herbal plants that you will not find even in the rarest part of India are being present over there, which are being preserved under the GEV community. So what I want to tell is, in all, whatever we have benefited was much or less important, but what you will benefit will be very beneficial, because all that related to your faculty is being over there. So we are just